Quality Manager and Associate GS of Christian Medical College, Vellore, which is the largest hospital in the country to be accredited by NABH. Prior to joining the healthcare, she was the Vice President of a software company and was a teaching assistant at Rodman School of Management, University of Toronto. A mechanical engineer by profession, she went on to complete her Master's and Doctorate in Business Administration, Diploma in CQI from the Canadian Healthcare Administration and Executive General Management from IIM, Bangalore. A passionate teacher and trainer, she is involved in training quality implementation across the country through NABH, CAHO, AHPI, and hospital administration programs. She is the Principal Assessor of NABH and National Secretary General of CAHO, India. She is a board member of the Asian Society for Quality, NABH, and member of the working group of ISO TZ304 Healthcare Quality Management Standards. She has many book chapters and publications to her credit and was a part of the developing entry-level guidelines of NABH standards, a joint initiative of NABH and World Bank. She was involved in overseeing the implementation of QMS in selected government hospitals of Karnataka through CAHO as a part of a World Bank funded project and a part of the task force of Karnataka Knowledge Commission implementation on procedure costing. She developed the basic and advanced certified professionals for quality implementation in hospitals programs for CAHO, which are well sought after, and 12 programs of CAHO. The best outgoing student of VIT Business School in 2000, she has won many awards and is a proud recipient of the Young Quality Achiever Award of 2016, Dr. M.S. Ashraf Award, Indian Medical Association, Tamil Nadu State for 2018, and D.L. Shah Award, QCI in 2016 and 2019, BMJ Southeast Asian Award in 2017, and the International Medal for the Asian Pacific region by the Australian Council 2021. A warm welcome to Dr. Lallu.
Am I audible now? Can you hear me? Am I audible?
Yes, ma'am.
Can the audience hear me too?
Yes, ma'am. Yes, ma'am.
All right. Can I start my screen share?
Yes, ma'am.
Okay. Is it possible to enable me? I'm on a disabled mode at the moment. Screen share option.
Yeah, we'll enable it, madam. Just a minute.
Do that.
Yeah.
Thank you.
Thank you for joining with us even into your busy schedule. Thank you so much, madam.
Thank you so much. My apologies as I'm not able to make it there in person. I really appreciate the KIMS ALSHIFA Hospital for conducting this patient safety conclave. It's indeed a pleasure to be part of this conclave. I must appreciate and thank Dr. Priyan, Dr. Khalil, Swati and the entire management team of ALSHIFA for having me here. And dear participants, My apologies to all of you as I'm not able to join in person. I'm sure the next conference, it will be my pleasure to join in person there. So today I'm going to be talking about a very new concept that CAHO and Patients for Patient Safety Foundation is trying to promote. I'm still on disabled mode. Is it possible to enable my slide share?
Madam, it is enabled.
No, it says host disabled participant screen sharing.
Just a minute, madam. Just a minute. No, madam. Can you try? Yeah, it's coming. It's coming. Yeah.
It's coming?
Yeah. Now we can see.
You can see my full screen, right?
Yes, yes.
All right. Thank you so much. And what are we going to do? The time that was given to me was about an hour, but unfortunately, I have to now cut short my presentation considering other assignments that I had scheduled. It was supposed to be from 12 o'clock to 1 o'clock. My apologies now, because there are several other meetings that are scheduled considering the World Patient Safety Day. I will keep it a little short, but I will not compromise on the essence and what I need to speak. So dear participants, we all know that the theme for this World Patient Safety Day is to engage and elevate the voice of our patients. We keep talking about patient safety in unison only at a hospital level, not at a healthcare delivery system level, not all of us together, all hospitals in unison. And we do not engage our patients in what we speak. So this mandate of WHO is much appreciated because it has come at the time when we really need to interact with our patients. So why? What is the need for interacting with the patients? That is the first part of my presentation. So the theme for the WHO World Patient Safety Day 2023 is engaging patients for patient safety. So there are two components here, engaging with patients, and the second component is towards patient safety. So what are the various ways in which we can engage? So I'll just give you a brief on the importance of this particular campaign and why should we engage with patients. So the global campaign for World Patient Safety Day has proposed a wide range of activities, which is probably what you all are doing too, for all stakeholders, including national level, at a governmental level, policy level, advocacy level, technical events, and conducting capacity building initiatives like training programs and all that they have proposed. So we are all aware of the increasing medical errors in our setting. We know the number of errors that happen. We always present a data of 0 when it comes to our accreditation assessments because we don't want to look poor when it comes to performance. But all of us as medical professionals really know the number of errors that happens, the number of near misses that happen in our healthcare setting. So because of these increasing medical errors and the kind of population that we are handling, at one time, our patients were not aware of what was happening. Today, Google is the best teacher for them. They Google, they come with all possible treatment options in front of them. With that in mind, every second they know what is happening in the healthcare delivery. Any small mistake or any small error is actually blown out of proportion. And what are the consequences of these small medical errors or large ones like never events that happen? This has resulted in trust deficit. So the medical errors can lead to a loss of trust in healthcare providers and the healthcare system. This can make the patients seek less likely to seek medical care, adhere to the plans that we are telling because they are forever going from one doctor to the other to validate what one doctor is saying or engage in preventive health behaviors. The other important impact that we have to understand is on the providers, the doctors, the nurses. So this medical errors can actually contribute to healthcare provider burnout. One small incident, and I'm sure that doctor or that nurse who committed it will be in a state of shock, will be going through several questions for which they'll have to answer. And they have this fear of violence, the legal repercussions that they need to face, and the added stress workload associated problems that they need to face. We call it typically the second victim syndrome, which is the person who's had the medical error is the first victim. The people who are engaged or the healthcare providers that, who are involved in that error, they are called as the second victims because they are also in a lot of stress. And all of us know that this can result in malpractice lawsuits, and that can be very damaging, costly, and time consuming. So what is the remedy? The remedy is talking to patients, patient engagement in whatever we do. We handle huge number of patients, and if you are not engaging with our patients, engagement doesn't mean that you have to spend 30 minutes, 1 hour with every patient. Engagement is that quality time that you spend, the right information that you receive, and also making sure that they know what you are going to be doing. They are part of the healthcare delivery. So when you do that, then they become partners of healthcare delivery. So patients can provide unique insights into the delivery process from their perspective. We don't understand their perspective. We only look at it from our perspective. Only when our own relatives or our own siblings or parents get admitted, then we understand what the patients go through. So their experiences can help us identify the gaps in the healthcare delivery, communicating failures and areas of improvement. And patient empowerment can enhance the trust between the patients and the healthcare delivery, the healthcare providers. So all this leads to a concept known as the shared decision making. Empowered patients are more likely to participate in that shared decision making. It is their decision. It is the healthcare provider and the patient jointly taking the decision, a collaborative decision on the care. It's not like dictating to them, this is what you need to undertake, without understanding the background, without understanding what they are going through, and without understanding whether it is needed for them at all, and without understanding their personal values and preferences. And we must understand that patients who are well informed and engaged in their healthcare process are more likely to follow the treatment you propose, and also they manage their health conditions more effectively. So we all believe that engaging with patients is the key to shared decision making. Now, how do we engage with patients? It's an art, and we need to understand that because we are a low and middle income country and we have our own problems, and we have a very varied population, a group of which is extremely well educated, very resourceful, and we also have the patients who have nothing, even the next day's meal. So we have a variety, we have a gamut, and how do we actually engage with these patients? So there are several strategies to achieve this. Of course, we all conduct the patient surveys and interviews. We have to foster open communication with them, create meetings with their family, facilitate participation in quality and patient safety initiatives. And the most important thing is develop their advocacy programs. We can use the digital platforms to engage with them. We have to provide the education and support. These are all theoretical terms as to how we can engage. I'm just speaking theory. But the most important thing that we must remember is to establish the Patient Advisory Council. This has proven to be a great tool. It is called as the Patient Advisory Council in some countries. This is not a new concept at all. This is a concept that is existing in developed countries. And this is something that is a great tool for us in our country to embark on. And that is why CAHO this year has taken this initiative along with the Patients for Patient Safety Foundation of CAHO to establish mechanisms of setting up patient advisory councils in hospitals. So this is not rocket science. This is just a concept which if we can adopt, it will make a huge benefit for us to engage with our patients. This kind of a concept, which is the Patient Advisory Council, is nothing but a group of individuals who have first-hand experience as patients or caregivers, who come together with you, with the senior leadership in your organization, and give their suggestions, recommendations on what you want to ask them. It is also called as the Patient and Family Advisory Councils. So what is this PAC? It gives patients a platform to voice their concerns and contribute to decision-making process. So they are going to be engaging with you to help develop systems and processes in your hospital, to validate your existing systems and processes, to tell you if they are effective. So you have to understand that there are several goals of establishing a patient advisory council. This is not something where you allow the patients to throw stones at you and say whatever you are doing is rubbish. It's a constructive exercise. So it's a way of working together in a very structured manner. If you do not have structure, if you do not have written down guidelines as to how this PAC is going to function, it's going to be chaotic. That is why we have taken efforts to put down the guidelines for our country as to how a PAC should be set up and how it can be run. So I'm going to briefly touch upon how to set up a PAC, how can you run it, how do you follow up on the decisions that you have taken in your organization through the PAC. Now, this guideline that we have developed along with 40 other stakeholders in our country is going to be released on September 17th at Bengaluru. September 17th, we have our World Patient Safety Day celebration from 10 a.m. to 12:30, and we are releasing a formal document, and after which we will share with all of you and your hospitals to set up the Patient Advisory Council. So, what are the goals of a PAC? PAC is working together in a structured way to improve communication and to build trust, involving the patients closely in sharing their experiences and needs. You can get very valuable insights from the patient feedback when you speak to them. These patient insights and voice can be used to understand their expectations, improve service experience, and also your clinical outcomes, because they indirectly work on the outcomes of the patients as well. So this is a platform to improve the two-way communication between the healthcare providers and the patients. This can be very useful in preventing adverse events, medical errors, and patient harms. You may ask me how, but let me tell you, there's another tool which we call as the PREMS, Patient Reported Experience Measures, that are actually used to understand the structures and processes that you have put together towards patient safety. That is also another guideline that we are going to be releasing as to how PREMS can be done. How do you do your own bespoke PREM tools? How do you validate them? And that again we will be sharing on September 17th with all of you. So the PAC will also help you determine effective ways to educate the patient community. So now let's move on to Patient Advisory Council and its purpose. The primary purpose of this council is to ensure that the patient's voice is heard and considered in decision-making process. By including patients in discussions and planning, your hospitals can gain insights into their needs, preferences, concerns, and ultimately leading to better patient care. So, is this something new I mentioned? No, certainly not. The International Association of Public Participation identified 5 levels of engagement, ranging from lesser to greater levels of engagement. In some areas, it is just informing. Second, consulting, involving, collaborating, and empowering. So we are actually at the moment at a consultative stage. So we have to now involve them, collaborate with them, and empower them, which is what we are going to be doing through PACs. Reports suggest 38 to 55% of acute care settings in the United States have the Patients Advisory Councils. In Canada, the PFACs, or Patients and Family Advisory Councils, are convened at the family practice level and at the regional, provincial levels and at the high authority levels as well. So this is not something new at all. Councils can be drawing members from across the institution. They could be population specific, focused on particular communities also, such as children, youth, and still very specific disease conditions as well, focused on cancer and diabetes. So there's enough literature to say that the PACs are across developed countries, ranging from at a national level, regional level, state level, hospital level, departmental level, and even disease specific level. So that is what I was trying to prove here. Now, this is a long overdue for us. So this is why it's so important that we have come together to set it up, to educate and build capacity in our country towards PAC. So I'm going to skip these slides and directly come to how do you set up a PAC. The first step, I'm going to talk a few steps here. And the first step is to how to set up a PAC. Remember, it is a voluntary process. Nobody is mandating you. But for all of us as healthcare providers who are committed to patient safety and collaborating with patients, which is important that we set it up immediately. So how do you start? One of you may be interested, your CEO, your quality manager, or a department head. So that person can take the start. He can make the move. He or she can make a small informal group, talk to people. And I'm sure because now we are formalizing, I'm sure the senior management will be more interested in taking it up. Form an informal core group, interested senior people in the hospital that can talk to the management. If the CEO himself or herself is directly committed, no problem. They will directly set it up, we are sure. But if they are not aware of this concept and some of you feel it's very important to set it up, take the lead. Form a small team, start talking to them. Go and represent to your CEO, COO, and they can, I'm sure, with your persuasive methods, will be in a better position to start this initiative because it has to be top driven. Top management commitment is a must for the success of this initiative. Now coming to step 2. So we need to identify that champion, that leader who can actually help in assisting. So the senior leadership, as I told you, is very, very crucial for this exercise. Now, the senior healthcare leadership, which is going to be involved, the key person, that key person is crucial. They can assist in developing a structure for your PAC, support member identification and selection for your PAC, also help in constructing the mission, vision statement, goal, bylaws. So remember, you should try and get about 4 to 5 members from the healthcare professionals, and we can call them as the healthcare professionals representative in the PAC. So that is going to be the core group. The person who's taking the lead need not be the team leader. The CEO can identify a clinician, a very senior member who has the acceptance to be to take the leadership. You can be a member there, but try and have about 4 to 5 members. Okay. Now, this is the crucial role, determining the composition and how do we recruit the members for this PAC. So, first, you can have your own internal brainstorming to decide who will be part of the PAC. So, it should ideally have a diverse mix of patient, family members, healthcare professionals, and hospital administrators. While deciding on it, consider population like the factors like the population you serve, the type of services, the scope of services you have, and any other specific quality improvement issues that you face. Something like a discharge process, which is a major problem for you. You may want to involve somebody who's very passionate about it. Then start recruiting members. Make sure the potential members understand the roles and responsibility, and they give you the commitment, not just for the sake of being as a member of this prestigious committee, but also contribute to the overall development. So it can be helpful to have a written role description for the PAC members. Don't leave it vague. Whether it is the patient representative, the healthcare professional representative, the facilitator, the lead of this committee, there should be written down rules and responsibilities for members of this committee. Now, the most important step is to identify the leader or the facilitator. A healthcare leader, I mentioned about it, preferably a clinician of the organization who values patient and family partnership and who has a very good rapport with the CEO can be made as the lead for this committee. He or she will become the chairperson of this committee. So you have initiated, as quality manager, you have initiated. You need not be the chairperson. Or if you are in such a position that you are able to make changes and the team listens to you, you can improve the system in your hospital. Certainly go ahead and take the role as the healthcare leader. But all that should be a consultative decision with the CEO and the senior leadership of the organization. Your CEO himself or herself can be the chairperson of the PAC. Now, you have to also select the healthcare professionals, the representatives, along with the core group that you have put together. So, you must remember, the leader and all of you should act as a bridge between the leadership and the PAC. So, I'm not getting into all this because I'm going to talk about the roles of each of the people who are going to be involved. Now, the most important thing is to identify the right people, the patients who are going to be the patient representative in your PAC. Remember one thing, you are not going to pay them. It's a voluntary process. So you have to select the right people. You can recruit them from present and past patients, preferably long-stay patients, because they would have gone through your system and they would have understood how you function. If you can pick them from your hospital database, and some of you can even suggest, there may be some patients who will constantly come and tell you, I've seen this in that hospital, why don't you put it here? The problem is happening here, I have a long waiting time, you could do things like this better, why don't you look at the Tatkal system of the railways, why don't you do? So those are people who are for constructive criticism, helping you develop systems. Select also through local communities, your civic bodies, patient support groups, NGOs, they all will have a voice as well. You may decide to choose one representative from them. Try and identify from diverse background. Don't just choose people who will speak and will not contribute anything at all. There are people who are very good in speaking, giving you problems but not solutions. So it's good to work with people from diverse backgrounds, men, women, professionals, uneducated. So have a mix of people and prepare to represent the patient and family perspective in the PAC. They should be prepared. They should know their roles. They should know that this is an exercise that is going to be useful for them as larger audience of patients. So they should be prepared to represent the patients and their perspective in the PAC. Now, anything that is not written down will not be effective. So you have to write a charter, which is a written document that outlines the PAC's purpose, objectives, membership, your meeting frequency, decision-making process, communication strategies, all that. That should become like a dossier for your organization. This will serve as a guide for the PAC operations and can help ensure all members understand their roles and expectations so that you don't go haywire. Now, other important thing, you've identified the HCP, you've identified the people, you've identified the leader. Now what do? The important step here is to start training and orienting them. This is something like setting up your institutional review board, IRB. What happens there? Every member in the IRB should be trained on their roles, on good clinical practices. In a similar fashion, before they come into the committee and you start the committee, start training and orienting them on what they should do, what they should not do. And the most important thing to remember here is you must train the patient representative on what they should not do. They cannot mandate policies saying this is how it should be. They should get involved. They should not get directly involved in clinical procedures. They can give you suggestions. Ask for favors or financial aid for patients. They typically tend to do that. I am in this committee, give me this free. My relative is coming, this one is coming. So you must clearly, explicitly tell them that they are going to be engaging with you as partners. And they cannot be aggressive, abrasive, and cannot have a non-congenial attitude. So these are things which you must try and tell them in the very beginning in a very nice manner. Once everything is done, launch the Patient Advisory Council. You may ask me how many members? Depending on the size of your organization, 2 to 20 members. Ratio. Please remember, you cannot have more healthcare professionals and less number of patients. Then they will feel intimidated. All of us will keep on rattling in medical terms. That's not what we need. We want them to talk. So have more number of patient representatives and less number of staff or healthcare professional representatives. Meeting frequency, at least 1 in 2 months. Tenure, keep it for 2 years. You may decide to keep it for 1 year. And you can also say the renewal can be for up to 2 years. This is not set in stone. These are just some guidelines for you to start the process of thinking about Patient Advisory Council. Please schedule regular meetings and implement the communication plan. So if you just put it in paper and you don't do it, it will just lie in paper. So you have to make sure whatever you have written down as a charter, as the plan for this Patient Advisory Council are carried out. The frequency of meetings, you have to also decide, depending on the objectives and availability of the members, you have to schedule the meetings. Now, what are the roles? This is very crucial for the patient advice, the leader, the healthcare professionals, the facilitator of this committee. Whoever has initiated can become the facilitator for this committee as well. So there are 4 terms that we use. One is the chairperson, the leader. The second one is the healthcare professional or the members from the hospital who are part of this committee. The third one is the patient representative. And the fourth one is the facilitator, who is like the secretary of this committee who coordinates everything. So Let's first talk about the patient, because this is all about patient. So the patient here should know their roles very clearly. They should understand the mandate as to why they are there. They should certainly commit time and be part of the meetings. They should also engage with the community, start talking to the people in the community, in their street, in their circles, trying to understand how they can collaborate and give constructive solutions, suggestions to the hospital. They should be in a position to facilitate communication and collaborate with the healthcare professional representative. So those are their roles. Now, what are the roles of the healthcare professionals who are part of the committee? Certainly, they have to understand the mission and vision of this committee. They should commit to active participation, not just the name in the committee. They should bridge the clinical perspectives with the patient. They are a vital link to tell them why something is done like this from the clinical perspective, rather than just, sometimes they will come with suggestions that are just not possible to implement because there will be some infection control issues, other things. So you should be in a position to bring out the clinical perspectives to the patients while you are having a conversation. You must be a facilitator to collaborate with the patient, engaging with the providers and the community, because you are in the middle at the moment as a healthcare professional representative, representing the cause of the hospital and trying to talk to them, supporting the initiatives, suggestions, recommendations, and implementing them in your healthcare setting. You should be very open for communication, promoting, allowing people to talk, listening, and making sure you promote open communication in the meeting. The role of the facilitator is very, very crucial. Ensures participation, making sure everybody is present, organizing and leading the meeting, starting the meeting. It's like the secretary of the committee. Facilitates collaboration and communication, not, just allowing everybody to keep on talking. You should be moderating as well, along with the chairperson. Tracking the process, the minutes, where have you led, what is happening, and making sure everybody is accountable for the decisions that are taken. Supporting the members and ensuring the implementation and recommendations and reporting those back to the committee. So anything that is not measured cannot be monitored at all. So you have to understand that the key to anything, quality management, is measuring. So you need to have the key performance indicators to say that my PAC is working well. So this might include specific changes that you have made to your hospital policies and procedures based on the recommendations from the PAC. Improvement in the patient satisfaction score can be a great KPI to say, I have implemented this based on the PAC recommendation. Now my patient satisfaction scores have improved, and other measurable outcomes related to the PAC's goals. So you need to, based on what you are discussing, what you are implementing, develop the key performance indicators. And please remember, external evaluation can be another crucial tool to see how your PAC is functioning. The third eye views everything with a different perspective. That is why we have accreditation agencies like NABH, JCI, QAI, all of them coming into your hospital and evaluating with the third eye, a different perspective. So once you set up the committee, 6 months down the line, you can invite an external member to evaluate how your committee is functioning, and they can give you valuable suggestions for improvement. Any small success, celebrate with a samosa, which is what we always say. I don't literally mean a samosa, but you have to learn to celebrate small success, recognize and celebrate the PAC's successes. This can help motivate members and build support for the PAC's work within the hospital community. Otherwise, they'll think it is another come, eat and tea committee. So it's important that you publicize this, make the hospital team members aware of what is happening, and publicize the achievements to the hospital staff, general public, so that they also feel engaged. Now, a few lines about the Patients for Patient Safety Foundation that we have said. I talked about establishing the PAC, how to run it, how to effectively monitor the performance of the PAC. Now, we are all there to facilitate and help you. That is why we took the lead along with the Patients for Patient Safety Foundation to set up the guidelines as to how, or release the guidelines as to how PACs can be set up. We are equal partners in the healthcare delivery system, ecosystem. So, Patients for Patient Safety Foundation is a not-for-profit society again that is established to engage with the patients. CAHO felt the need along with QI to actively engage with the patients. And therefore, we set up this foundation. The main idea is patients taking the responsibility for their health. The tagline is, my health, my responsibility. Every patient should remember, my health, my responsibility. And therefore, they are not going to be blaming healthcare providers for their health. So it's important that they take responsibility. So it's a not-for-profit trust promoted by CAHO for enhancing patient safety by involving the patients. The main objective is to encourage patients and to play an active role in the healthcare journey to improve outcomes and to reduce avoidable harm. So, everybody is a partner when it comes to the Patients for Patient Safety Foundation. The Patient Advisory Council, we feel, is the midpoint. It is the crux of what we are going to be doing. How CAHO and P4PSF are going to be functioning together is what I have put together in the slide. And I'm not going to take much time dealing with this, but we are there as Patients for Patient Safety Foundation to help you engage with the patients. So there are several educational materials, training materials, all aiming towards patients, trying to make them understand their roles. We keep talking about patients' rights and responsibilities. Patients themselves need to know, and therefore the first step we have taken is to educate the patients at a national level on their rights and also to know that they have a responsibility towards the healthcare delivery in a hospital. So what is the role of CAHO? CAHO, as you all know, is the consortium of accredited healthcare organizations, and we are established to promote quality, patient safety, and accreditation in the country. So CAHO, is a valuable partner, and I'm sure it's going to be with you throughout, helping you set up this very important initiative that we are advocating, which is the Patient Advisory Councils. So we are here to create awareness and education for setting up of PACs, and also we will provide enough capacity building exercises through webinars, through training programs, and we are developing a training program for patient advisors, healthcare leaders, as to be part of this setting up of the Patient Advisory Council, how to set it up, how to take it forward, how to effectively monitor. All those will be taken through training programs. As I told you, the guidelines and best practices is something that we wanted to publish. We had put a group of 40 senior members together, and we are now ready with the guidelines, which will be rolled out on September 17. We are for capacity building, and that is what we do. We have 47 training programs focusing on various aspects of quality and patient safety, and now on patient advisory councils as well. So facilitation and networking is something that we do, and I'm not divulging more into that. I'm sure all of you are partners of CAHO. If you're still not a member of CAHO, would recommend all of you to join. Now, there's another initiative that we thought we must be doing, which is going to be the external evaluation of PACs. We are there to support you, evaluate once you set up your PACs as to how effective your PACs are. So we are there for you. We may even start programs to recognize well-established PACs in the country, which is a long-term dream, and I'm sure anything long-term is just about a year, considering the kind of partnership and the love and recognition the industry has given to CAHO. So certainly we will be coming out with recognizing programs on the successful implementation of PACs in your hospitals. So that's about what we are going to be doing and how we can collaborate and work together. I must tell you that the success of such councils ultimately depends on the commitment and active participations of everybody, hospitals, healthcare providers, patients, and families. A collaborative effort involving all stakeholders is crucial to create a patient-centered healthcare delivery system environment that leads to better health outcomes and enhanced patient. What I call just in time. I finished my talk and the connection went off. Thanks. Yeah. Over to all of you, and if there are any questions, I'm very...
Thank you so much for your valuable insights, madam. We'll over to the audience for any questions. Just be here with us. Any questions from anyone? We have Joseph sir and Gracie Matai madam and Dr. B.K. Rana sir here. Just a few words because she is not here directly, so a few words.
Hi, Dr. Lallu. I heard a little of you, but I know what all you are going to talk will be the high impression to the people, and it's going to be implemented by the people. It was very good. Okay.
Thank you, and you are all the trendsetters. I see Dr. Rana there, who actually initiated the formation of the Patient Safety Foundation. I recognize the contributions of Madam Gracie Mathai, who was part of our team to develop the Patient Advisory Council, and I'm sure she's going to be with us on 17th as we release the guidelines. So, and Joseph sir, I don't have to say anything. Joseph sir is a great friend, and when Joseph sir and I go for assessment, the entire assessment will be Joseph, Joseph, and Joseph. Lallu Joseph, Joseph, Joseph. Thank you, sir.
Good, Lallu. Good to hear you. Good. Thanks for elaborating on PSCs. So I think it's worth mentioning on the day of patient safety. It brings people together to make impact on the life of the ultimate beneficiary, which is the patient and family. So thank you for your impressive presentation. Thanks.
Thank you, sir.
Yeah, it's our pleasure and privilege to have you all here and connected to one platform. So thank you so much. Next, over to the anchor, please.
Thank you, Dr. Lallu Joseph, for your outstanding contributions. Ladies and gentlemen, it's a pleasure to introduce Dr. B.K. Rana for our Q&A session. Please feel free to ask questions. Let's engage in a meaningful exchange of ideas.
Should I stay on or can I take leave?
Any questions from the audience for Dr. Lallu Joseph?
I think everybody understood the best out from you, and if anything questions are there, we will post you through the mail and we'll connect you to Madam. We value your time and thank you so much for connecting with us in your short notice and with your busy schedules. Thank you so much. Take care. God bless you. Bye.
Thank you.
Thank you, ma'am.
Bye-bye.